Hi, I'm Dr. Ed Beyer. Today we're going to be talking about reason number 8 on why someone's thyroid function can be low. You know, in my clinic I see all the time, especially females come to me and they're like, they're in this thyroid dilemma and in this mess, and they're suffering from fatigue and weight gain and hair loss and depression and brain fog, and they need extra sleep, and their life's just miserable. And they're going to their doctor and they're getting their T4 looked at, they're getting their TSH looked at. And one of the things, I just shake my head because there are 22 reasons in the scientific literature. I am not making this stuff up, folks. This is all in scientific literature. And I have a lot of doctors asking me, where is the literature? I can show it to them, okay? I just don't include it in my slides on why our thyroid function can really tank. And this is a very common one that I'm going to share with you today, and that is progesterone deficiency. And the number one cause of progesterone deficiency is birth control pills. We seem to believe that taking birth control pills is this benign medication that a lot of females go on to regulate their cycle or to get rid of a lot of PMS symptoms, and we tend to believe that they are harmless chemicals. Let me tell you that they are not. And one of the things that they can do is they can shut down your thyroid function. And that's what we're going to talk about today. Now, progesterone, what it actually does is it increases the enzyme thyroid peroxidase in the thyroid gland. And we all know that progesterone increases at the time of ovulation. A female gets a surge of progesterone in the second half of her cycle right after she ovulates. This is the reason why a female's temperature goes up, because they have a surge of thyroid hormone being produced at that time. And so this is really important. It increases our metabolism. Now, a female is meant to ovulate. When they are on the pill, they do not ovulate, and they do not form what is known as a corpus luteum, which is the follicle that develops in the ovary. Starts to mature under the influence of estrogen in the first half of the female cycle. Once the egg is developed and erupts from the follicle and goes into the fallopian tube, that remaining follicle is called a corpus luteum, which in Latin means yellow body, and it starts to produce gobs and lots of progesterone in the second half of the cycle. And progesterone stimulates the enzyme that makes T4 and T3. And many females have this, and I have never seen a traditional medical doctor look at this, and low progesterone being a cause of their underactive thyroid. So birth control pills cause low thyroid function. Other symptoms of progesterone deficiency, and many of my female patients have this for other reasons besides birth control pills, anxiety especially. Progesterone is very calming to the brain. It actually activates receptors for a neurotransmitter called GABA aminobutyric acid, which calms the brain. Depression, weight gain, mood swings, low libido, PMS, irregular cycles, breast tenderness, fibrocystic breast, fibroids, endometriosis, gallbladder problems, hair loss, bone loss, hair and bone loss. Hair loss is like, I have a clinic, I just got done finishing seeing patients today, and I bet half of my females are complaining of hair loss. Progesterone deficiency is one of the many causes of that. Hot flashes, night sweats, vaginal dryness, vaginal atrophy. These are all the symptoms of progesterone deficiency. It's a very, very common thing. Now, there are other reasons besides not ovulating and birth control pills that can cause low progesterone. Unstable blood sugar, which is called dysglycemia. Systemic inflammation will cause it. Weak adrenal glands, especially in a female who's menopausal. Women, when they go into menopause, that's when estrogen starts to really drop, and they depend on their adrenal glands more for their estrogen production and fat cells. And what happens though, and the average age of menopause is 51, but what happens in females is progesterone starts to drop in their early 30s. So by the time they hit 50, 51, they go into menopause, their progesterone's been dropping for a long time, and they need good adrenal function to combat that. Proper testing is very crucial. It's important that we look at the free fraction of the hormone, we know that salivary testing is a much more accurate way to assess progesterone levels, not serum, not blood, but salivary testing. And it's important that we test during the second half of the female cycle, which is known as the luteal phase, because in an ovulating or menstruating female, that's when progesterone is at its highest. Think of the name progesterone. It's progestation. And so the second half of the cycle, the brain in a female thinks that they may be pregnant, so they need a lot of progesterone to prepare the uterus for implantation. And then we need to look at functional ranges. If you've been watching my videos, you know there's a big difference between lab ranges, which is based on sick people, and functional ranges. That's really important. So proper progesterone is absolutely crucial. And it's one of the reasons why that we have to look at in low functioning thyroid. I'm Dr. Beyer. Hope that helps. Have a great day.